Okay, good morning, everyone. Welcome to the first meeting of 2022 for the Committee of Management. I will call the meeting to order. First item of business is the election of the chair and vice chair for this year. The floor is now open for nominations. Councillor Robinson.
Good morning, everyone. It is my pleasure to nominate Scott Mackey for chair of this committee.
Thank you. Do I have a seconder? Councillor Woodbury, thank you. Do I have any other nominations for chair? Seeing none, can I have a motion, please, to close nominations? Councillor Klumpus, Councillor Burley, thank you. Councillor Mackey, are you willing to be the chair of the Committee of Management?
Yes, Heather, I will stand for one more year. Thank you.
Thank you very much. I'll confirm that Councillor Mackey is the chair of the Long-Term Care Committee of Management for 2022. Floor is now open for nominations for vice chair. Councillor Burley.
I nominate Christine Robson, please.
Okay, thank you. Do I have a seconder? Councillor O'Leary, thank you. Any other motions or nominations for vice chair? Can I have a motion to close nominations, please? Councillor Woodbury, Councillor Klumpus, thank you. Councillor Robinson, willing to stand as vice chair for the Committee of Management?
Absolutely, and thank you very much, one and all.
Thank you. All right, nominations are complete. Chair Mackey, the meeting is yours. I will confirm that we have all members of the Committee of Management here today.
All right. Good morning, committee members and senior staff. Thank you to my nominators and for the support of the committee members for my election of as chair. I had spoken with Heather earlier, or I guess it was last week now, and as Jen mentioned, our staff are very busy, working through, different ministry correspondence and trying to keep staffing in place. So we felt it was best that we allow those senior team members to continue with their role and look after the residents of our long-term care facility. So I hope that's okay with everyone, but I'm sure Jen and Kim will be able to answer any questions that may arise. We have just to remind members of the committee of their obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. We have LTCR-CM 0122, the long-term care operational report, October 15th to December 14th. I have a resolution that the report LTCR-CM 0122 regarding the long-term care operational report dated October 15th to December 14th, 2021 be received for information. Can I have a mover for that, please? Moved by Brian and seconded by Dwight. I'll turn that over to you, Jen.
Great, thank you, Mr. Chair. I'm just going to bring my notes in front of me here. So I can only partially see you, all of you. So if you have a question, just speak up and I'll stop. So I will do my best to go through the operations report. I'm going to hit the high level items and do my best to respond to any questions. If there's some nitty-gritty specifics, I may need to go back to the EDs and I will do that and follow up. Glasses are helpful. So I'm just going to start with the quality section, and the chart there continues to demonstrate the data that aligns with the Commission report, recognizing that acuity levels of residents have increased, requiring greater levels of care, with most of our residents needing extensive assistance. To support long-term care homes with not only providing quality care for residents, but also care that aligns with best practice, the Ministry of Long-Term Care has provided funding for each of our care communities to access a digital clinical decision support tool. Each home is receiving $5,000. $4,000 of that is being spent on the clinical support tool, and the other $1,000 is being used to offset the annual cost of point-click care, which is our documentation software. So the clinical specialist and accreditation and quality specialist are leading this project, they've met with the team from Think Research to review the clinical support tool and ensure that it achieves the deliverables that are set out by the funding requirements. And those are detailed here in this report. Upon reviewing the clinical support tool with each of the care communities, and after getting a strong endorsement from over 50% of the long-term care homes in the province who are using this tool already, we are in the process of finalizing the agreement and implementation of the new tool that will take place in the first quarter of 2022. So that's exciting and a great opportunity from the province for us to build our quality improvement initiatives. Ministry of Long-Term Care compliance and inspection findings. Lee Manor had an inspection during the reporting period as a follow-up to the compliance order and a critical incident system inspection. The formal report has yet to be issued. Rockwood Terrace, we spoke about this inspection at our last meeting, but had not yet received the public report. So we spoke about it and then needed to highlight that we have since received the public report, and it is attached here. Outbreaks during this reporting period, there were no outbreaks, but when we get to the COVID update, I will give an update on the current status. Under people, all 3 long-term care homes continue to work to recognize and acknowledge the really fabulous people that we have working in all of our homes, continuing to recruit and provide opportunities for students. Grey Gables is continuing with the training efforts to support the Behavioral Support Transition Unit pilot. Lee Manor has welcomed a new office coordinator. She comes with experience working as an office manager with both People Care and Rivera, and we're excited to welcome her to the team. Rockwood Terrace has welcomed a new nutrition manager, and she also comes with several years of experience working in care communities and also supporting at a corporate level. Projects, locations, events. So this reporting period is October to December, and all of the homes worked hard with residents and staff and the community to recognize the various events that take place during that time period. So focusing on Remembrance Day, preparing for Christmas, even though it's called our second COVID Christmas. I really hope we don't have a third COVID Christmas, but the teams did all that they could to make the second COVID Christmas as special as possible. I guess Halloween was in there as well. So this section just highlights some of the opportunities to try to bring some normalcy to the residents' lives in the homes. Occupancy, the chart here highlights the occupancy, and I just want to note for committee that the provincial relief of meeting the 97% occupancy requirement is set to expire on January 31st. So currently we are protected in having less than 97% occupancy until the end of the month. We are monitoring this situation closely, and I understand from provincial updates that we will continue to be protected as we were pre-COVID in terms of occupancy related to outbreaks. So if we are not able to admit during an outbreak, there is protection for that. Those beds are excluded from the count. So just to highlight that for committee. All 3 homes had regular inspections from across the spectrum over this reporting period, and also conducted their emergency preparedness drills, etc. Lee Manor did receive 4 written complaints during the reporting period, and they were followed up, reported appropriately, and followed up with the leadership team and the complainants. And finally, to highlight some color it stories, it's not uncommon for Grey Gables or any of the homes to be supported by members of the community, but this holiday season was truly a joyous thing to witness, from handmade art projects to fuzzy blankets. The communities continue to surround us with their support, and the residents with their support and encouragement, and it's most appreciated. Lee Manor Staff from Lee Manor and the County of Grey teamed up to cross an item off one of the residents' bucket lists. And Mary Ellen really wanted to see and tour the renovated county building across the road from Lee Manor. And so that tour was facilitated. And Mary Ellen commented on how pleased she was with the efforts and the time spent to showcase the building and the exhibits. So a special thank you to our partners at the County of Grey for helping make Mary Ellen's Day really special. And at Rockwood Terrace, I just want to highlight that the residents would normally, in other years, take a bus tour of the Festival of Lights and Own Sound. And this year that wasn't a possibility with various COVID restrictions, as well as the buses were struggling with staffing shortages. So the recreation team created a Festival of Lights in the auditorium on site at Rockwood Terrace. And there is a link to the video there if you want to check it out. It was pretty great. The resident family council meetings continue to happen at all 3 locations, and we really appreciate the feedback and information that we get from our residents and from our family councils. And the resident and family satisfaction surveys were completed also during this reporting period. And in an upcoming meeting, we will do a summary of the results of those surveys. And I think, Mr. Chair, that concludes that report.
Thanks very much, Jen, for that report. Questions from members. Brian, go ahead.
Thank you, Mr. Chair. I have 2 or 3 items here that I want to mention. I started out reading about these new hires. Bethany Rupp as a new office coordinator. She has 4 years experience as office manager position in long-term care. When I read that, I was kind of curious as to whether that would be like a promotion for her, like a better job, or one step down, or wherever it was. And then I read Sherry McDonald as a new nutrition manager, and then the new physio assistant. And then it suddenly occurred to me, I don't really have a handle on what the chain of command looks like. Do we have a chart showing, Jennifer at the top and then managers and all the way down to what we have and what we don't have?
We do. Thank you, Councillor O'Leary. And we do, and I can circulate that to committee. Okay,
and I should apologize if it's already been sent out and I missed it or whatever. But anyway, I was just curious to see something like that. My second concern is, I've talked about this before, even before the pandemic, when my mother was in Lee Manor. I come out of that whole situation saying that PSWs were severely underpaid, just my opinion. But now we're in this position of they've got this $3 raise and they've had it for a long time. And obviously in very stressful conditions. I'm concerned about when that $3 an hour comes off their paycheck. And I wonder what the general feeling is with everyone. Like, should we be rallying around these people and start lobbying for that $3 to stay? Or I just see that's going to be a sudden problem with all these PSWs doing what they're doing in the situation that they're in. And then all of a sudden they're going to take a $3 cut in pay and everyone's going to forget about it except for them.
Kim?
I would say that here at the county, because of our collective agreements and because of the environment that we've been in for a long time, where we've had to compete for staff who were very scarce, I think our wage grid was maybe not the same as what some other places were doing. But that doesn't take anything away from what you're saying, was that $3 has been around now for a good long time and has kind of, I think, probably been baked into people's budgets and way of going. And it will be a hard thing to see that go. So I think you're not wrong that, seeing that to continue on would be really, really appreciated and an important staff retention tool. That said, as I said, we were starting at a different spot than some of the other long-term care organizations.
Jen, I think I saw your hand.
Yeah, the only other thing I'll add, I agree with everything that's been said, is that there does need to be some work done to balance so that the grid, so that it all kind of aligns with the different roles. So the increase for PSWs has just created a bit of a disconnect with RPN wages and some of the other positions. So there is some advocacy for doing some balancing there. But again, also, like Kim said, that doesn't negate the comments that you have shared, Councillor O'Leary.
Thanks for that to both of you. Like, I don't know what the answer is. I just wanted to throw it out there in case there's something somebody can do just to be proactive. Obviously, it's going to happen at some point, and I think we should be ready for it. Thanks for your patience. I have one more. Jennifer, now that we've had a death, I know in a perfect world, we'd all like to say, you know, it's just part of the job. Everybody understands that this can happen and that sort of thing. But you also hear stories of the firefighter who, you know, wanted to be a firefighter all his life until he pulls a dead child out of a burned building or something. I'm just wondering how everybody handles the death, and do we have assistance available for anything that may take place that's on the negative side?
Through you, Mr. Chair. Thank you again, Councillor O'Leary. I'll start with assistance. Yes, we are very fortunate to have the Employee Assistance Program that has been supported and endorsed by Grey County Council, available to all of our staff and team members across the organization. And we do work hard to talk about that often so that there's a comfort level in accessing that support. So we do have that. We also work to have processes and systems in place that give people an opportunity to acknowledge the challenges that come with working in long-term care, with supporting people who you've made a relationship with, even a therapeutic relationship at the end of their life, and some affect us differently than others. I also just want to acknowledge and send our condolences to the family and of the resident who passed away during the COVID outbreak from COVID. That did impact people in a little bit of a different way. So we also acknowledge that and are working to offer support. And it is a challenging part of the position and the role in working in long-term care.
Okay, thanks, Jennifer. Thanks, Mr. Chair. It's all.
So before I take other questions, I don't want to lose sight of Brian's comments around the $3 an hour for our PSWs. You know, that extends across the province for, you know, people in a variety of sectors that have been chronically underpaid. Is there a role for county council to maybe send a resolution to the province asking for the pandemic pay to be put in place permanently in agencies' budgets? Kim, what are your thoughts on that?
I think that I would want to follow the lead of Advantage Ontario, who is really, representing and understanding the perspectives across the whole sector, and has that lead towards advising the government as far as where they should be going. And I say that because, like everything else, this is a little bit complex. There's an awful lot of concern out there about Bill 124 and the issues with the nurses as well. And we're involved ourselves in those negotiations with ONA. So I think there's a lot of moving parts, and I think we need to be very careful about moving forward one thing without having some consideration of the whole health human resources situation. So I don't know, Jen, if you're at the Advantage table, has there been discussion there yet? I think everyone's been so focused on just getting through the pandemic that there hasn't been a lot of time for these more broad conversations, but certainly they need to happen. And so if there was communication and a resolution from council, it might be that we really want to look at the whole picture of compensation for folks.
Okay.
Jen?
I know I read in the paper it was just in the last couple of days where the Nurses Association is looking for parity with police officers and firefighters.
Yeah.
So Jen, I think I saw your hand.
Sure, thanks. Thanks, Mr. Chair. I would just add to what Kim said that Advantage did in the last couple of weeks release their advocacy document.
Yes.
And so I can go back and reference it. There is some information in there and I just can't recall it in detail, but it's out there. And so I can pull that and do some follow-up.
Okay. Well, please let us know if this committee or council can be of any assistance. Brian, go ahead.
Sorry, Mr. Chair. I just want to make sure I didn't send the wrong message. What I was trying to say is that, I always thought even before the pandemic that PSWs were underpaid in the first place. And I don't want to take anything away from, people like Jennifer who have been, overwhelmed with work and management and that sort of thing. I understand all that. I was just kind of thinking, or I was expressing what I was thinking even before the pandemic. Thanks.
All right, John, did I see your hand?
Yeah, I just wanted to mention something as far as employee support. And this is more for kind of down the road a little bit. We had EAP in the fire service and we kept that, but we went to a slightly different model that had peer support. And if something happened that was kind of either out of the ordinary or affected somebody out of the ordinary, like we ran a simple medical call and the person that we were working on reminded one of my crew members of his 15-year-old niece and really shook him. We were able to call the peer support group, and it was just 2 other firefighters from within our own department, but somewhere else, could come in and just sit down. They had a series of questions they'd ask or talk, but you were talking to somebody that had been there or been somewhere similar. And we found that cut off a whole lot of EAP counseling and got things out in the open and out of the way within hours type of thing. So down the road, a peer type thing may be a good thing. Unless, of course, you've already got it, and then that's great.
Thanks, John. Jen?
Sure, if I might, and thank you, Councillor Woodbury. Before the pandemic, we had started developing a Code Lavender program that sounds very similar to what you're describing, but I think there's opportunity to learn from our colleagues in paramedic services and fire service of how we might enhance that so that because it's never a cookie cutter approach, right? People need some different options. And I agree, when things had started to slow down with the pandemic before the recent surge, I'm very concerned about the next 2 or 3 years and people, reflecting on their 2 years or 3 years of the pandemic, and we need to be there for them to support them.
Okay. Other questions from committee members? Warden, go ahead.
Thank you, Mr. Chair. 2 of my questions have been answered since I originally raised my hand, but one question just for clarification, and I think I have the answer, but I just want to confirm it. The $3 per hour enhancement for PSWs, that is sort of blanket, right? That's not intended to bring you up to a particular threshold.
Through you, Mr. Chair, that's correct. And that also adds to some of the complexities in that it didn't resolve any of the wage disparity between home and community care PSWs, long-term care in various organizations, be it charitable, nonprofit, private, or municipal. And so it did provide support to people that needed it, but it didn't fix that disparity.
Right. Sounds a lot like the sort of challenge that you have in childcare, ECEs. You know, do I work for a private childcare facility or within a board of education? It really doesn't fix that issue. It just elevated everyone the same. Thank you.
Anything else? All right, we'll call the question. All in support of the update, and that is carried. Thank you. We now have LTCRCM 0222, the long-term care COVID-19 update. That report LTCRCM 0222 regarding the long-term care COVID-19 update be received for information. Can I have a mover, please? Moved by Barb and seconded by Christine. We'll turn it back over to you, Jennifer.
Great, thank you, Mr. Chair. And again, I'm bringing my notes in front of me, so I can't see everyone. So it was always difficult to get this COVID update to be as timely as I wanted in terms of our timelines, and it was especially difficult this time. There's a lot of moving parts, so I may add some information verbally just to catch you up on where we are right now. So I'll just start with the executive summary. All 3 of our long-term care homes are currently in active COVID-19 outbreak. We did start the new year with continued vigilance and then subsequently escalated into full outbreak measures to ensure the safety of our residents, families, and team members. We've received a number of updates, so December 14th, 23rd, 28th, 30th, January 4th, and then there has been several since then as well, outlining updated measures and guidance as a result of the new variant Omicron. The new measures have affected vaccination, surveillance testing, visiting, leaves of absence, resident activities, IPAC measures, 3rd and 4th dose vaccinations. Our homes quickly implemented all new strategies that came into effect the week of December 15th to 17th. We held a virtual family meeting on December 20th and again on January 6th to provide clarification and answer questions related to the new guidance. Infection prevention and control measures continue to be in place, and we continue to monitor our PPE supplies to ensure we have an 8-week supply at all times. So this summarizes the various outbreaks and changes as a chronology. So on December 22nd, a COVID-19 outbreak was declared at Rockwood Terrace. The outbreak initially affected 2nd floor, but on December 24th, Public Health declared a home-wide outbreak. The outbreak to date, and I believe that this is about a week behind, had affected 14 residents and 8 staff. We've already discussed this a little bit. I am saddened to report that 1 resident death did occur. As of January 10th, that's when it was effective, sorry, January 10th, there is 1 active case on 3rd floor and 2 active staff cases. That number is different today. All team members worked quickly to implement enhanced IPAC measures and worked closely with public health to contain the spread. Health status reports are provided daily to families of COVID positive residents. So someone is identified at every home, and part of their role is to phone the power of attorney or whoever is designated by the resident every day and give them a status update on any residents who have tested positive for COVID. We also provide general updates through a daily communication through our MailChimp service and also to our designated care partners through our email contacts. All general visits and leaves were suspended at the home. On December 24th, protective measures were also implemented at Grey Gables and Lee Manor, which included suspending general visits and resident outings, and that was about a week before the province made those changes across all long-term care homes. We did that a few days ahead. On December 27th, a respiratory outbreak at Lee Manor, which has since been identified as seasonal coronavirus, which is an agent that causes the common cold, was declared on 2 South at Lee Manor. The outbreak was contained to 2 South, and as of January 10th, had affected 11 residents and 4 staff. And I'm pleased to report that earlier this week, that outbreak has been declared over on 2 South. Through ongoing surveillance testing, we did experience positive test results of COVID for staff that had worked on 2 South and 3 South. As a precaution, all residents on 2 South and 3 South, along with identified staff, were PCR tested immediately. We also are providing our daily communications to resident families and staff. On January 9th, a COVID outbreak was declared on 3 South. Confirmed positive cases to date are 5 staff and 1 resident on 3 South. In-room meal service is implemented for all residents, and all staff on 3 South are wearing N95 masks. On January 6th, Public Health declared a suspect COVID outbreak on Grey Gables Maple Lane home area, affecting 1 resident and 5 staff. On January 9th, we received confirmation that 4 staff members had tested positive and a home-wide COVID-19 outbreak was declared. There are still no resident cases, even as late as yesterday. I haven't heard the update for today. Residents are cohorted to their home areas, and all residents and staff are PCR tested and have transitioned to N95 masks. Enhanced IPAC measures are implemented at all 3 homes. We are holding daily outbreak management meetings, and public health attends and supports those meetings. IPAC audits are conducted daily, and additional supports are utilized. The leadership teams have activated their 7-day-a-week rotation to provide daily support. So there's members of the leadership team on site 7 days a week. EMS staff and Health and Safety Manager Carrie Miser have assisted with on-site mask fit testing. Rockwood Terrace staffing levels were critical over the Christmas holidays, and leaders, retired staff, along with EMS, supported the home. Designated care partners also played a crucial role during the outbreaks. Many DCPs arranged their visits to align with mealtime, and some also provided hands-on assistance with personal care, and we're very grateful for that support. Vaccination. So as of December 13th, all team members, support workers, students, and volunteers were fully vaccinated with the definition of 2 vaccines. The mandatory vaccination directive did result in the termination of 3% of our team members across the 3 homes. 3rd dose booster clinics have been held in November and December for team members and designated care partners. Effective December 16th, the Ministry of Health COVID vaccine 3rd dose recommendation was updated to shorten the waiting period. So that allowed us to offer the vaccine to a larger number of people. On December 31st, it was announced that 4th dose vaccinations would be available for residents of long-term care homes, retirement homes, and older adults living in congregate settings. We are working through the process of determining eligibility and getting consent signed for residents for their 4th dose, and I believe that residents are starting to receive their 4th dose this week. We aren't during the outbreak, so if a home area is an outbreak, as advised by public health, we're holding the 4th dose until that outbreak is cleared. It's also been announced that the 3rd dose is now mandatory for all staff, students, and volunteers and caregivers into long-term care. So the details of that are bulleted here. It is a little bit complicated, but everyone who is eligible now must have their 3rd dose by January 28th. Anyone who is eligible past January 28th must have it by March 14th. So there's a little bit of sorting out there to be done. And we really appreciate our partners in HR who are helping us track and coordinate those details. The chart in the report highlights the status of vaccinations. This was as of January 7th, and anecdotally, I heard an update yesterday that 3rd dose, we're closer to 80% now. So the homes have really put a push on making sure that vaccinations are available as easily as possible on site. We're calling it a la carte. if you walk by the cart and you want it, you get a vaccination and you're eligible. So, so really grateful for the teams managing an outbreak and also trying to get as many vaccinations into eligible people as possible. Surveillance testing also had some significant changes since we've last met. So I'm just trying to summarize here. Somewhere around December 14th, we started increasing rapid antigen testing to every other shift. And so that's been happening now for a number of weeks. If our supply allows, we are currently looking at offering rapid testing for every shift, just as another layer of protection. And many staff are actually requesting to do their rapid test every shift. They just want to be sure that that they are coming in a safe way. So the homes, across the homes, we're doing about over 1,500 tests every week. Visiting leaves and absences. So this highlights the chronology of the, I guess, increased restrictions to residents in limiting their leaves of absence for day outings. As soon as we went into confirmed outbreak, those were suspended anyway, but we actually stopped them in Grey County on December 26th. And we're really grateful for people, the residents understanding and their loved ones understanding that we just felt it was necessary to provide that protection for everyone. IPAC strategies. On December 18th, we received an update for N95 use. And so any resident who had a symptom or was positive, COVID positive, so if they're isolating in their room, we immediately switch to N95 use for the staff providing direct care for them. Now we have N95 use happening in any area that is in COVID outbreak. All three locations have also modified break and lunchroom areas to ensure physical distancing and are cohorting onto the home area. So lunch and break rooms are now on every home area to support that. Designated Care Partner Program, the annual resident family survey was released in November and included some specific questions for our designated care partners. I also wanted to highlight that our Designated Care Partner Program has been selected to be part of Advantage Ontario's annual conference in 2022 in April. And so we look forward to sharing our tools, resources, and lessons learned with other long-term care homes. We've already talked about Designated Care Partners' requirement to have their third dose. And so that's highlighted there. And I did just want to also mention that we continue to be extremely grateful for the support of our DCPs. They continue to care for and advocate for their loved one. And when called upon to assist with meals during critical staffing shortages, they were there without a hesitation. And so we're really appreciative of that. Staffing. With the increased numbers of COVID cases associated within the community and school, some staff were required to self-isolate due to their children being exposed or ill. All three locations have contingency plans in place, and leadership teams, as we discussed, were on standby and are actually now on site 7 days a week. On December 23rd, a memo was received from the Associate Deputy Minister outlining additional supports for homes, including the vaccination, surveillance testing, and the test to work policy. Grey County Long-Term Care had made a commitment early in that time to only be using the 7-day time frame in an emergency situation with support of Grey Bruce Public Health. This provincial guidance has been updated a couple of times, December 31st and then again on January 14th. There were a lot of questions about how the guidance might work in a staffing crisis. Many discussions were held with the health unit about how this guidance would roll out locally. On Saturday, January 15th, long-term care operators received a memo from Public Health confirming that long-term care operators would move forward with a provincial guidance released on January 14th. This provides a framework that outlines a variety of options along with the associated level of risk. And as recommended, we will be utilizing the least risk approach as appropriate. So the framework gives you different scenarios as to the level of staffing crisis and the level of risk that you might be wanting to take, and we would take the least risk approach. The ministry announced also that the limiting work to a single long-term care home has been lifted, and they provide a framework of how to support staff to work in more than one location while working in an outbreak. It's advised that staff members who work in an outbreak in one unit would also work in an outbreak area of a second work location. Funding, the PSW wage enhancement extension was set to expire on October 31st, and it has now been extended until March 31st. And there was also a note received possibly after this writing of this report that the ministry is advancing the January and February COVID containment funding to homes right away. And so there's indication through Advantage that the hope is that there will then be an extension of it beyond February, the COVID containment funding. So we'll wait to hear that. We continue to work with partnerships, both regionally and at the local level. The Grey Goose Long-Term Care Committee and partners are meeting weekly for the next 6 to 8 weeks while we support our long-term care homes through this surge. Long-term care homes attend the public health-led meetings every 2 weeks. The Southwest Regional Pandemic Response, those meetings have increased frequency, and collaborations are ongoing with our healthcare partners to discuss operations for a local staffing response team. Continue to be thankful for the support of council, the CAO and senior management team and staff in all departments who are brushing off their education booklets from 2 years ago about redeployment in the case that we might need some of their support on site. And a couple of team members from Economic and Development Department who supported in the early days have already put their hand up to say that they're ready to step in and provide support at the long-term care home. So we're really grateful for that support. And I know that was a lot, and there's about 14 bullet points of attachments if you wish to read through them. Thank you for your patience.
Jennifer, that was a lot of information, but first let me start by extending, on behalf of the committee, our sincere thanks and gratitude to both you and Kim, as senior managers for long-term care. I don't think any of us can, truly appreciate the amount of work that goes into all these provincial mandates, to IPAC, to testing, to, providing that information to 500 staff and then implementing all the changes. It's truly amazing what you've done. Please, the two of you, pass on our thanks to our designated care partners, to I read where people were coming back that were retired are helping out, people that are on education leaves coming back in. It's been a real team effort, and we do very much appreciate all those efforts, and I hope this is over soon so that the two of you can have a little bit of time off. But hopefully the next 6 weeks will end that. But again, thank you, heartfelt thanks, and keep up the good work. Questions from committee members? Dwight, go ahead.
Thank you, Mr. Chair, and Jennifer, an excellent report. Just amazing what you and your team do. A question for you. You indicate in your report that 3% of your team were terminated because of non-vaccinated. I'm just curious, if any of these 3% team members get vaccinated, are they allowed to come back to the workforce? And if they are, do they need extra training, and do they keep their seniority?
Jennifer?
Thank you. Through you, Mr. Chair. So I can answer 2 out of 3 of those questions. Absolutely, we're happy to have them back. And in some cases, we have welcomed back some team members who have changed their mind or changed their position. In terms of training, I think that the timing is such that they would be due for their annual training anyway, and so they would participate in that annual required training that all staff are required to have. And in terms of seniority, I
think we'd want to look at, because we have 3 different bargaining agents, the 3 collective agreements aren't identical, sadly. And so I think we'd want to just make sure that we were adhering to the letter of each of the articles in those 3 collective agreements before we could answer that for sure, I think.
Yeah, thank you. If Chair Mackey, I wondered if I just might, I wanted to thank you for the acknowledgement, and I will definitely pass that on to the team. And I did just want to say that in the daily updates that go out to families through the MailChimp, we talk about staffing levels, and we'll say staffing levels are stable. And I want to say that they're stable because of the dedicated team members that are doing extra hours, picking up extra shifts, working 6 days a week, maybe more. And so I wanted just to acknowledge that it truly is a team effort. And while it is stable in terms of getting things done, it's stable because of those people going above and beyond.
Thanks, Jennifer. Any other questions from committee members? Warden, go ahead.
Thank you, Mr. Chairman. I echo everything that you just said in terms of the accolades that are well deserved. I got to tell you, I will often say to an assistant that I see working in my law office, how they're working on something and then the phone rings and they get distracted and they have to attend to whatever it is that came up on that phone and then find their way back to the document they were working on and whatnot. I have no idea how I just don't have that skill set. When I read and hear, you started off by saying there are many moving parts. When I hear you talk about those moving parts and I read about it, I absolutely get a headache. I just don't know how you keep on top of that and manage the size of team, 400 people at play here in various places and various rules coming at you left, right, and center. It is just insane. I couldn't do your job, but I'm glad that you do your job. So I just want to repeat everything that the chairman has said. Well deserved, and please extend our thanks, of course, to all of your team.
Okay. Well, again, thanks, Jen and Kim. All in favor of the COVID update report? That is carried. We now have LTCR CM 0322 titled the 2021 Long-Term Care Write-Off and Uncollectible Accounts be received, and that the recommended write-offs in the amount of $28,701 as outlined in the report be approved. Can I have a mover, please? Moved by Dwight and seconded by Brian. And who is taking this? Marcus. Welcome, Marcus.
Thank you, Mr. Chair.
I don't think we've met. Can you introduce yourself to the committee, please?
Yes, absolutely. I was just to say thank you, committee. I've been on in the background, just listening, as I'm the financial analyst for long-term care. So I'm here on the finance side, handling the background stuff. And so now it's my turn in starting to present the reports and bringing it to you. So please bear with me, as I'm not as polished as Jen or Kim or anything like that, but I will do my best, and we'll get better as we go through more reports.
Well, welcome to the team, Marcus. And just for the committee's benefit and my benefit, Joanna, is she still involved with long-term care in the financial department? No.
No,
Kim?
Joanna's no longer with the county.
Oh, okay. All right. Well, I see Mary Lou there. Okay.
Yes.
Thank you. Okay, Marcus, go ahead.
Thank you. The report brought forward, the LTCR CM 0322, is the write-off of uncollectible accounts. This is a standard report presented annually due to ministry requirements and guidelines. The ministry requires us to write off any outstanding resident account as of December 31st, regardless of status or what we're kind of moving with it. So what happens with this is that if there is any that we write off at the end of the year, the ministry will reimburse it at 50% of the basic accommodation, none of the additional services that they might encounter. However, our homes do a tremendous job on the collectability and collections of these amounts. So what happens is we reapply them as of January and continue our collection. As the amount states for 2021, the $28,701, in the table just below, you have the breakdown between the homes. All of the accounts are in process of collection. What they are either delayed, whether it be from legalities with PGT getting them on board, or there is a payment plan in place. It's just the ministry requires us at December 31st to report this amount and say that it needs to be written off in that. But we reapply and we continue. And as you can see, even with the amount of bad debt recovery, we've got multiple years since we've had to actually write off anything to the ministry to collect on, because our coordinators are great at collecting on this kind of stuff.
All right.
That's actually about it for the report. So,
okay, questions from committee members? Just a question from the chair, Marcus. A person living in one of our homes, does their old age security and supplement cover the cost of a ward bed or a semi-private bed?
Go ahead, Mary.
Mary Lou?
So every year, the residence rate is based on their previous year's notice of assessment. So once the notice of assessment is available, it's typically June or July, and that kind of aligns with when the province would give any rate increases. What happens is, for somebody that's in a basic bed, they provide their information and it's income tested, no different than, it's a slightly different calculation, but same idea as for housing. And then that calculates what they pay. So for example, if you're in a preferred bed, you're not income tested unless we placed you there because there is a behavioral issue. And in that point, the province would supplement and pay us the preferred portion. So if you're in a preferred bed, you have to be able to pay the full rates. If you're in a basic bed, you pay what you can afford and the province pays us the difference. And so when we get our monthly payment calculation notice from the province, they've estimated what our basic accommodation is through conversations with each home, and they pay us a percentage. And then they do annual comparisons, and then they true up based on what we're seeing coming in from residents. And then finally, when we file our annual report with the province, I think right now we're up to about 2018 being reconciled. Then that's when the final true up occurs. So what it does is what the person pays is based on their ability to pay, less they keep, and then Jen can correct me, it used to be called comfort allowance. So they're entitled to keep, it's probably somewhere around $150 a month, which pays for things that the home isn't required to pay. So if you wanted clothing, snacks, etc.
Okay, thank you, Mary Lou. Just a follow-up. Do most of our clients, are they in charge of their finances, or do they have a power of attorney looking after it? Jen?
Through you, Mr. Chair, and thanks. That was an excellent description, Mary Lou. And so most of our residents have a power of attorney assigned for finances. Some residents are able to manage their own finances, but the majority have designated someone as their power of attorney for finances. All 3 homes also contract social worker, which supports residents who are navigating the very complex financial system. So if they just help make sure they've applied for all of the provincial opportunities that are available to them, that they filed the right paperwork, et cetera, to support them. It's a big change to move into long-term care. So the social workers provide that support as well.
Okay, well, I'm just trying to figure out how much I need to save up. Thanks. Any other questions from committee members?
If I can, I'm not sure that we answered your question about whether or not the cost of a basic bed aligned with what the province says that the charge for a basic bed is. And so, of course, what you get in retirement is a whole calculation based on what you contributed over your employed life, et cetera. But according to what I see there today, the average benefit for CPP is $700 a month. And then I guess if you would qualify over that for the income supplement, there would be some additional funds, but the cost of a basic bed is at $1,200-ish. Is that right?
It is through you, Mr. Chair, but the rate reduction process takes that into account and tops up what they might not be bringing in based on their notice of assessment.
Yeah.
So I guess technically they're not making enough to pay the basic rate. The province is still topping up.
But it's not coming to the levy at the county.
That's right.
That's right.
It's through the province. It's through the province supplementing.
So the bottom line, someone on old age old age security and the supplement, there wouldn't be any levy requirement. If they're under the amount that is required for that bed, that is covered by the province. Okay, thank you. All right, any other questions from committee members? We'll call a question. All in favor of the write-off report? That is carried. Is there anything else, Kim or Jen?
I don't think so today, but I do want to echo the thanks for all of you. Your support, your comments, your questions throughout all of this have really been gratefully received. Thank you so much. It means a lot to know that you guys are around us and supporting us. So thank you.
We're all in your corner. Please let us know if there's anything that we can do. All right. Thanks, committee members. Seeing nothing else, can I have a mover to adjourn, please? Moved by John and seconded by Dwight. We now stand adjourned. All in favor? That is carried. Thanks, everyone.
Thanks, everyone.
Enjoy the rest of your week.
Bye-bye.
Thanks. Bye.